Dr. Dixie Melillo and I started the Rose in 1986, a whole lot of people didn't even know what a mammogram was. But many people understood what it meant to be without insurance. It was the Pasadena community that embraced us the most. It was the women who said, we want to help other women. And that is what's made the Rose grow to where it is today. Today we are serving over 40,000 women a year, and of those women, 8,000 plus do not have insurance. That is why we think that it is so important that every woman have access to care. We've seen what happens when they don't. Today we offer mammograms and ultrasounds and diagnostic workups. We have 5 mobile mammography coaches and 2 diagnostic centers. But most of all, what we've had through all these years has been the support of the community. As a nonprofit organization, we depend on the grants and the individual gifts and our fundraisers to make sure that we can provide the mammography services that we do. But there are some things that simply are needed that it's very difficult for us to do. And one of them was having our own podcast recording studio. The Bill and Helen Crowder Foundation stepped up and made that happen. We are so grateful to them, so grateful to all of the people in our community that help us continue to deliver this message that women must have access to care. So some of the people laugh when I tell them that we started with garage sales and bake sales, and we sold men at a bachelor's auction. But I think the one community event that we have that is so important has been our shrimp boil. And this is where, like 800 of your closest friends come together, and we all enjoy an afternoon of great food, great music, and just in the fellowship of being with each other. Not many people realize that the Rose has the largest mobile mammography fleet in Texas, and we're serving 43 counties throughout southeast Texas. But I think the most important thing that I have learned throughout this time of having mobile has been that this is what helps women to have their annual mammogram. 75% of the women who have their mammogram on the coaches tell us, well, I just wouldn't have had it done this year. And that's why they are so important. That's why community support for the coaches are so important. That's why employers that bring it out and have it available for their employees, that is so incredibly important to access to care. It's important to getting that mammogram done. It's important to early detection.
I was actually at a women's event and I came across a booth. There was a lot of pink, and that's the first time that I saw the Rose. I spoke to one of the representatives, received more information, and immediately the following week I went back to our OC Health group and asked, how can we make this happen for our employees? Mobile mammography is so important. When you think about just the time it takes to make an appointment, the greater Houston area is so big, depending upon where your healthcare providers are, that could be an easy 2 hours out of your day that you sometimes don't have. So it was very convenient to provide this service on site so our employees and their spouses didn't have to take time away. I want to thank the Rose so much for the services that they provide. It's so important to have your screenings. Early detection saves lives. So thank you so much for your partnership in taking care of our employees.